If you're here, there's a good chance that the word depression or mood issues really just doesn't cut it for you anymore, because it's so much more than a word, right? It's waking up early, already tired, already behind before the day even begins. It's a mind that keeps pulling you back into the same negative thoughts, reviewing the past, pulling you into the future. What's wrong? What's not working? What's never going to change? And for many, kind of heaviness, a hopelessness, or even things you used to enjoy just don't have the same good feeling anymore. You withdraw a bit, then a bit more. You stop reaching out. You go through the motions sometimes, but you're just not there. And for many, maybe the hardest part, it's that a part of you started to wonder, is this just how it's going to be? By the time most people land here, you've already tried a lot. And I mean a lot. Most have done therapy, different therapists. They've read books and more books and tried medications, maybe several medications, adjusting and switching and hoping each time this will be the one that turns it around, right? And that's understandable. And maybe out of all of that, something's helped a little, but it didn't hold, or the side effects got in the way, or you never quite felt like yourself again. Look, this is not a failure on your part. It's because most approaches are trying to manage symptoms without truly changing how the brain is functioning. Hi there, I'm Dr. Randy Cale, licensed psychologist. I've been at this for over 30 years, helping individuals who feel exactly like this. People like you, perhaps, who are doing their best to hold things together while something underneath just isn't working the way it should. Yet here's what's often missed. Depression and mood struggles. It's not just behavioral or emotional. They're patterns in brain functioning. These patterns, they drive everything. Low energy, negative thinking loops, emotional instability, poor focus, disrupted sleep. If those patterns don't change, look, that cycle just continues. And this is where neurofeedback is different. Instead of talking about the problem, we work directly with the brain to change those underlying patterns. We start with a QEEG brain map so we can see how your brain is functioning. And we train it using neurofeedback. Gently, precisely, consistently, and quite elegantly, your brain learns to shift out of those patterns and into healthier, more stable patterns. No forcing, no guessing. And with considerable amount of ease, you will find change unfolds, subtly at first. A little more energy, a little more clarity, a little less emotional weight, but then something bigger begins to happen. You don't feel like you're fighting your own mind. You start showing up differently. Life opens back up just a bit and a bit more, but over time, the doorway to a full life swings wide open. It almost seems like a miracle at times to me, but neurofeedback works because we're not about managing symptoms. It's about helping your brain learn how to function better. The changes are measurable, they're predictable and sustained. So when change happens at the level of brain patterning, sleep improves, outlook becomes brighter, relationships become richer, work becomes more fulfilling, and happiness has room to expand. Look, if what I've described appeals to you, I suggest we have a conversation, a free consultation where we can talk about what you've experienced, what you've tried, and you can discover if this approach makes sense for you. You don't have to keep guessing your way through it. You'll find the scheduling link right below this video. Set up that free consultation, and it may be the first real step toward getting yourself back. I look forward to chatting. Take care.